Well, it should come to no surprise this morning, our moment with the mayor topic today, the coronavirus pandemic. We welcome Mayor G.T. Bynum via Skype this morning with important information about continued efforts by the city. Good morning, Mayor. Thank you so much for your leadership. Really appreciate you during this time. Want to ask you first, so the governor yesterday scaled back the elective surgeries a little bit and also extended the stay-at-home order by a week for the vulnerable populations. How does that affect you, and does this anticipate any changes on a city scale?
Well, I had the chance to visit with the governor and with Mayor Holt, my colleague in Oklahoma City, yesterday before the governor made that announcement. I think it's a smart move to make. The restriction on elective surgeries that he put in place a couple weeks ago was to make sure that our hospitals had capacity both for beds and for protective equipment. And what we see is it's given them time to build up that capacity. And so at least our hospitals in Tulsa, which are the ones I talk with, they feel like they have the capacity to handle more patients and to handle the anticipated peak in hospitalizations that we're expecting in the next couple of weeks from COVID-19. So the one thing that the governor and Mayor Holt and I talked about yesterday, though, is as we look forward to when our public health professionals tell us that it's safe to start ramping down these social distancing practices over a period of time, that we're really all on the same page and in sync, both with Tulsa and OKC, but certainly from the governor's standpoint from a statewide basis. So I was really grateful because I feel like in the early going of this, you had Tulsa doing one thing, Oklahoma City doing something, and then suburbs in our metro areas doing things and different cities around the state doing other things. And so I think the governor saying that, you know, we all want to be on the same page moving forward was really valuable.
I've heard you speaking about the budget and the mayor of Norman talking recently about how Oklahoma could be affected more greatly because of the fact that we're the only state in the nation who relies so heavily on our sales tax revenue. Has that triggered any efforts? Can anything be done to change that or look at things differently?
Well, you're exactly right. The Brookings Institution released a report this week showing cities across America who they expect to be most greatly impacted by this. And both Tulsa and Oklahoma City were in the top 10 cities in the whole country that are expected to be impacted by this because we're in a state that forces its cities to be so reliant on sales tax revenue for our operations. The relatively good news, though, is that as soon as this event started, we recognized that the city of Tulsa, the danger it could prevent from a budgetary standpoint. So we immediately imposed a hiring freeze over a month ago. We immediately banned employee travel over a month ago. And then the city council and I have spent the last 3 years building up our rainy day fund to help us ride out a situation just like this. And so I'll be presenting the budget for the coming fiscal year that'll start July 1 to the city council next Wednesday night. But we expect, you know, our team at the city is going to have to make some sacrifices to keep providing the existing level of service to Tulsans. I don't foresee at this point the need for layoffs. That's always the worst possible scenario, especially at a time of economic uncertainty, which can lead to increases in crime. We certainly don't want to be cutting back on our public safety manpower that we spent years building up. But we're going to have to make sacrifices at the city, and I'm going to be pretty candid with our team at the city over the next week on what that looks like.
Quickly, we have to go, but what's on your plate today? What's your focus?
My big focus is working with our local industry clusters and with the Tulsa Health Department on what kinds of practices we can put in place when this ramp down begins so that people feel safe going to restaurants, people feel safe going to get a haircut, people feel safe going out and doing the types of things that they were doing before this began. You know, this event is not going to be over on May 1st. It is going to extend for probably until we have a vaccine. but there are things that we can put in place now that allow people to get back to some semblance of normalcy while reducing their risk. And so I'm talking with industry groups and with our health department on what that could look like.
Appreciate your time. Thank you so much. Have a great day.
Thank you.
Moment with the mayor, COVID-19 response. For more updates and details, they are keeping those updated at cityoftulsa.org/coronavirus resource center.